Hi, Madeline Lowry here, nutritional therapy practitioner and also a MAP method practitioner, which is an advanced method of neural retraining. I want to talk about how childhood trauma affects lifelong health. This is a theme that was expounded upon in Gabor Mate's new book, When the Body Says No. I highly recommend this book. There are also many, many interviews with him on YouTube that you can search. Just search the title of the book. In this book, he talks about how he talks about the stress disease connection, but particularly for those that have childhood trauma histories. And this is how I came to the same understanding, just through a different way, a different method. So I was trained as a nutritional therapy practitioner, and I started working with people with digestive issues, allergies and sensitivities, and autoimmune conditions. Those were kind of my three focuses, and still are. And I found in working with people with allergies and sensitivities, and particularly in teaching a neural retraining method, a very basic neural retraining method that I call Retrain Your Brain. I found that about 70 to 75% of the people that I taught, so this is mostly an educational process in which we teach a set of mental practices that you go and practice at home. It's about an hour a day, but it does take 3 to 6 months. So this is most appropriate for people that have multiple severe allergies to food, chemicals, electromagnetic fields, or environmental factors like mold, pollen, dust, whatever. About 70 to 75% of the people that I worked with could achieve their goals, right? So this method trains the brain back to tolerance for all categories of allergens or irritants at the same time, right? So it's quite fast. We see results within weeks. Within weeks. But for about 25 to 30% of my clients who tried it, they would hit a certain point and they would kind of stall out. I couldn't really understand that until I started to track who had moderate to severe childhood trauma histories. That was the correlating factor. And I started to realize that there is something about having that more severe. So I would put myself in the category of moderate, right? So my ACEs score is about a 5. So I put myself in kind of that moderate range. But for people who had other people who had moderate to severe childhood trauma histories, they just weren't able to retrain the brain sufficiently with just using the basic neural training method that I had. And so I went and I trained in another neural retraining method, an advanced one. And with this method, the MAP method, it's a custom method. It is a practitioner directed method in which you and I, the client and I, can sit in a Zoom video conference, for example, and I initiate their subconscious mind to the process. And then we talk about what the subject is for the session. And then I start to provide instructions. So like I facilitate the session by providing instructions to the superconscious mind of my client. And the superconscious mind rewires the client's brain right there in the session, right in front of me. So we are monitoring the process throughout. So it's like instruction, treatment, sum rating. Like, how is that feeling now? Instruction, treatment, sum rating. Okay, how is that feeling now? And so in this way, we can quite specifically get to traumas, both remembered and not remembered. The superconscious mind will actually take us to where we need to go. I say superconscious mind. I'm talking about the subconscious mind, but in the MAP method, we had given it the new name of the superconscious mind because it is actually superior to our conscious mind. It's not sub anything. And so we can work in a very custom way, very individualized way to find these root causes and neutralize them. So this is this allowed me to see, working with people with the MAP method has allowed me to see the kinds of experiences that can contribute to chronic physical illness, everything from chronic fatigue, chronic pain syndromes, certainly allergies and sensitivities, um, and anxiety and depression. And when I talk about, chronic pain, I mean, I'm talking about back pain. I'm talking about joint pain, tendonitis, carpal tunnel, right? All the various manifestations of chronic ongoing pain in the body. As Dr. Sarno points out in his book, The Mind Body Prescription, he says, consider that the largest bone in the body, the large bone in the leg, we break that bone, it heals in about 6 weeks. And at that point, it is stronger at the point of fracture than it was before, right? So if you have ongoing pain that's lasting months, there is something else going on there, right? There's some other process that's going on. And that process is most often tied to something going on in the subconscious mind. So how does this relate? How do we relate childhood traumas to chronic illness going on in the present day, right? Why did it wait so long to manifest, you might be wondering? Well, the significance of having a trauma early in life, and what kind of traumas are we talking about? If you go and Google the ACEs quiz, ACES, Adverse Childhood Experiences quiz, you will, it's like a set of 10 questions, very short. And I don't think it's a complete barometer of adverse childhood experiences, but it's a good starting place. You can also find the CDC study for around adverse childhood experiences and their findings on how this affects people into adulthood. And they found that has many effects, including, chronic health, the incidence of chronic health issues in people with childhood trauma is many times higher than the average population, the non-traumatized population, as we can put it, and also the incidence of addictions. And Gabor Maté talks about both in his book. So how do these relate? Well, in my mind, right, as a MAP practitioner, my understanding of Dr. Gary Flint's book, A Theory of the Personality, if you look at the mind as a computer, right, the most powerful supercomputer that was ever created, the human mind. And we know that a computer is useless, right, if there's no software on it. It doesn't help us. You can't do anything with it. We have to have software. We have to have an operating system. Where does the operating system of a human being come from? Well, it's downloaded. It's created in the first few years of life. So as a young child, children are absorbing, experiencing, they're witnessing things happening around them, and they are inferring, right? They're learning from this. And this is creating a kind of operating system that operates in the subconscious mind, not only as a child, but for the rest of their lives. That's the operating system that you're working with throughout your life. And so what I believe is that there can be, in the operating system, there can be intensely painful memories, intensely painful emotions and beliefs that we created around these trauma experiences that are at play throughout the rest of our lives. At some other point, this might be exacerbated by certain personality traits. Personality traits like what John Sarno describes as the perfect and the good, right? That drive to be a perfectionist, that drive to achieve, to succeed, that drive to be very disciplined, to feel very responsible for things, to take a very serious attitude towards life, that drive to be the good person, the person who's always helpful, the person who helps everyone, the person that's the people pleaser, the person that feels compelled to maintain harmony in the group, right? Often, how? often by suppressing or repressing their own needs, their own emotions. So all of these personality traits I've just mentioned, they're all very stressful because, for the same reason, because they require that we suppress our own emotions and needs in the service of others. And so that combination of early childhood trauma, certain personality traits, and then sometimes even current um, sources of stress, right? Job stress, financial stress, emotional stress, relationship stress, loss of loved ones, any number of things. Um, it kind of adds up. And even if it's not current, like if you think about when your symptoms began and you think about this year, the months to years prior to the presentation of those symptoms, ask yourself, was there a stress there? Was that a stressful period for me? What was going on? Because I think when you start to see this pattern in yourself, then I think that starts to give you this sense of how the subconscious mind, unconscious emotions can play into the physical manifestations of what we call symptoms. So what can we do about this, right? If this is starting to make some sense to you, if you've read Bruce Lipton's The Biology of Belief, and you've learned how subconsciously held beliefs affect physical symptoms, physical health, if you've read The Emotion Code by Dr. Bradley Nelson, and you've learned about how trapped emotions in the body can manifest as symptoms, all of these thought leaders, right, are coming to the same conclusion. They have different ways of explaining it, but they all kind of circle around the emotions that we don't feel, the emotions that exist in the subconscious and the unconscious, but they are not actively felt, and how these can be very potent instigators of chronic health issues. So what can we do about this? How do we work with the subconscious mind? There are probably different approaches to this, but the technique that I learned that I really think is very powerful and is just leaps and bounds over some of the techniques that have been practiced before, like EMDR and tapping, is the MAP method. With the MAP method, we have a very powerful tool for creating a rapport with the superconscious mind, or the subconscious mind, as I was explaining before. And we can actually trace back from the symptom or from the emotional, the painful emotional event. We can trace back to the root causes. We can neutralize them, and then we can let these memories, these emotions, these beliefs go. And in doing so, we reduce the stress, not just the known stresses, but the unconscious stresses that are weighing on us, that are resulting in these physical manifestations of disease. If that makes any sense to you, if you see yourself in these descriptions, I encourage you to sign up for a free 15-minute consultation with me. We can talk about what you're experiencing, how the MAP method might be appropriate for you, or even the Retrain Your Brain method for allergies and sensitivities. Or if you want to jump right into it, I encourage you to sign up for your first MAP session, the introductory MAP session. You can find the link on my website and register for it. It's a 60-minute session. It's very simple, it's very gentle, it's very powerful, and the results are permanent. So I do encourage you to try it. Thanks.